Having an annual wellness visit allows your primary care provider to attain new information about your past medical history, family history, social history pertinent to your current and future health. This, along with the pertinent vital signs, will allow your healthcare team to assess your health status and risks. Health risk assessments, medical and family history, list of current medications, list of providers involved in the patient's care, and social determinants of health are reviewed. Along with this, vital signs like blood pressure, pulse, height, weight, BMI, and waist circumference are also obtained as deemed appropriate. Assessment is also made regarding cognition, functional abilities, depression screening, and safety. Having an up-to-date medical history, family history, list of medications, list of allergies or adverse reactions, and the list of providers involved in your care will allow you to get the most out of this visit. It is never too early to start thinking about advanced care planning, and your provider will help you to discuss this in detail. Within the initial 12 months of getting Medicare, you are eligible for an initial preventative physical exam. Thereafter, Medicare will pay for an annual wellness visit every 12 months. For non-Medicare patients or for commercial insurance, please check with your insurance carrier to see if they provide these benefits. Medicare will cover the annual wellness visit with no cost sharing to you. But sometimes your healthcare needs may need to be evaluated and managed at the same visit, and that will lead to cost sharing, just like other clinic visits. For non-Medicare patients and commercial insurance patients, the benefit plan may vary, so please check with your insurance before the visit.